My name is Mark Tyler, and I'm going to talk to you a little bit about what happens to you, the patient, when you undergo an open rhinoplasty operation. Now, as you know, the aim of the operation is to change the size and shape and various angles of your nose, and I've already discussed that in a previous video. So, once you've decided that you're going to have an open rhinoplasty, what will happen is that you will arrive in the hospital on the day of your operation. You'll see me, or the surgeon that's going to do the surgery, and you'll also see the anaesthetist. We'll run through the nature and the aims of the operation with you. We'll get you to sign a consent form, and you'll probably have your photograph taken. We'll then go down to theatre. During the course of the operation, obviously we'll do all those elements of the operation that we've discussed with you beforehand. As far as you're concerned, when you wake up, your nose should be fairly numb, so there's not a great deal of pain when you first wake up, because we put lots of local anaesthetic in. You may well find that your nostrils feel a little bit blocked, either because they're swollen or because we've put packs in. We rarely put packs in, but occasionally we do. You'll have a hard plastic cover, splint that covers your nose, that extends onto your forehead, and that'll be the most obvious sign that you've had a nose operation to anyone that looks at you. The other thing that will be happening is that you may well start to get a little bit of bruising along your eyelids here, because during the course of the operation, any bleeding that happens in the nose often spreads to underneath the eyelids. You'll be sitting up, you'll have a little pack along the bottom of the nose just to catch any drips of blood that may come after your operation. You'll go back to the ward and you'll spend the night with us in the hospital. The surgeon will come around and see you the following morning just to check that everything's fine, and you'll then be allowed to get away home. At this point, you'll have the splint on your head, you'll have some black eyes, the nose will feel a little bit blocked, and you may get a dull ache around the nose, for which usually paracetamol or a little bit of Brufen, or a combination of both, is enough. When you get home, we're going to ask you just to take it easy for the first week. We don't want you doing anything that would start your nose rebleeding again. Most patients have had a nosebleed before, and as you're aware, if you've had a nosebleed, if you put your head down to do any work, or if the nose can restart again. So anything that you think would start a nosebleed, we want you to avoid. Putting your head down, that's sitting in a hot bath, having a hot curry, or doing any form of strenuous exercise. We'll also ask you to try and sit up with a few extra pillows so that some of the bruising and swelling is reduced. And 1 week after the operation, you come along and see me. We take the splint off, we take a couple of little stitches here that are removed, and the remainder of them are actually inside the nose. At this point, you should be able to see the broad effects of what your operation has done, although the nose remains really quite swollen. It's very common for people to notice that the swelling actually increases after we take the splint off, because that's been acting a bit like a compressive bandage, like a tubercle on a swollen ankle for the week, and when we remove it, it can often get a little bigger. It'll often take about 6 weeks before the main amount of swelling settles, and then it'll actually continue, the swelling will continue to get better over the ensuing months after the operation. The things that you'll notice about your nose is it feels very wooden and very numb. It is numb. That feeling will start to come back. The wooden, hard aspect to it will start to soften as the swelling goes. The other things you may notice is that your sense of smell may be a little bit diminished, and obviously it's going to take a couple of weeks, if you do have any obvious bruising underneath the eyes, for that to settle down. During that first 6 weeks, the nose is a little bit delicate, a little bit tender, and I ask you to avoid any sports or anything that may involve contact with the side of the nose, as that may well distort the nose if it's sufficiently hard. Those are the main aspects that I'd like you to do. Most patients that come to see me that are involved in face-to-face work in their workplace can return to work after a couple of weeks. If your appearances are extremely sensitive, such as you work in television, then you may find it's advisable